A very good morning to everyone present here. Today I'll be presenting about the clinical spectrum of open globe injury in a tertiary care center. So open globe injury, as we all know, is one of
You
the
just
most
adjust the mic. You can make it up.
is one of the most common causes of ocular injury, resulting in permanent visual blindness, and it can result in various complications involving both anterior segment and posterior segment. And timely intervention can help in both prognostication and visual recovery, and helps reduce the complication. So the aims of our study was to study the clinical spectrum of open globe injury presented to a tertiary care center, and the primary objective was to study demographics and the clinical characteristics of open globe injury, and our secondary objectives were to evaluate the visual outcomes of open globe injury and to assess the complication and prognosis of the patient. So we included all the patients of ocular injuries reporting to our emergency and the ophthalmology OPD who consented to participate in the study and who were willing for follow-ups. And we excluded the patients with the periocular injuries. It was a hospital-based prospective observational study, and all the patients of open globe injury were included, and the study sample area was Department of Ophthalmology at AIIMS Bhatinda. The sample size was based on the hospital selection of all open globe injury patients presenting to our department, and a total of 55 patients presented with open globe injury within the study duration. Following primary intervention, we were kept under follow-ups for 3 months. After informed consent, we did a primary examination and primary intervention was done, and the post-operative assessment was done. And after that, we kept the patient on close follow-up, and we did an ocular examination and recorded the data, and we kept for analysis. So we can see that the most common type of injury reported at our department was zone 1, followed by zone 2 and zone 3, with zone 1 being more common, up to 56% of the patient. And most common type of injury according to the BETS classification, we were reporting most common penetrating trauma, followed by few cases of retained intraocular foreign body, and there was also one case of rupture as well. The sex distribution was again there was a higher male dominance. It could be secondary to higher outdoor activity of male sex. Some peculiar distribution of laterality as well, that the right eye was more involved in the left eye. And the mode of injury, the most common mode we found was secondary to road traffic accident. It was followed by occupational accident and assault as well. The time of presentation in our case is majority of the patients presented within less than 6 hours of the injury, and a few number of cases also presented after 72 hours as well. So the mean final best corrected visual acuity on the basis of presentation time varied greatly, as the patients who presented earlier had a better prognosis on the logMA value as compared to the patients who presented late. And the patients who were presenting early, they showed more amount of improvement, as we can see on this graph, and as compared to the patients who were presenting late. There were also a number of various reported complications in our study. The most common complication at the end of the 3 months we reported was astigmatism. It was followed by cataract and corneal scarring and hyphema as well. And there were also a few cases of phthisis bulbar and ophthalmitis. And surprisingly, there were also some cases of dry eye and limbal stem cell deficiency as well. And we can see that by the uh, corneal thinning reported the best visual gain following after 3 months, and retinal detachment and vitreous hemorrhage, being the posterior segment complications, reported a lower visual gain after 3 months. And the patients with corneal astigmatism showed more amount of improvement as well. So most of the patients were underwent a primary repair, and few of the cases, high risk cases, which we thought it would be they were on a high risk of endophthalmitis, we also did a primary repair with injection of intraocular antibiotics as well. So on the final visual outcome, we can see that the zone 1 injuries correlated with the best visual gain, followed by zone 2, and zone 3 had the worst prognosis out of all, which was again confirmed on the ocular trauma score as well. We can see that the patients having the ocular trauma score of 5 showed the highest amount of improvement on the logMAR value as compared to the patients of ocular trauma score of 1. Also, an age group comparative study as well. We reported the most of the patients were included in the working group, which was 30 to 39 years of age. Few cases were also there which were less than 20 years of age, including few number of pediatric patients as well, and one of them also 80-year-old patient as well. So most of the patients were middle-aged male, commonly injured through accidents and road traffic accident. Delayed presentation was frequent and have influenced the visual outcome as well, resulting in poor visual gains after 3 months. And the penetrating injuries was most common type. Zone 1 was most commonly involved. Zone 3 injuries correlated with poor visual prognosis, and visual acuity significantly improved in patients with higher OPS score.
So did you take a specific consent from the patient whether they want to be included in the study or not?
So we explained it to the patient as well that we will be keeping you under follow-up as you will be coming to OPD, and we will be documenting whatever the finding we had. So there was no specific consent for this.
And if they didn't agree?
So we excluded them for the study, sir.